So obviously medication is super important. I take medication every day, just like most people with Parkinson's. But what you realize is that there's so many other things that impact our symptoms, not just medication and other surgical interventions and things like that, because it really is a whole body disease. And no medication, no treatment treats everything. We're just treating different symptoms. So I had the idea of what that prescription would look like. So I put 6 items that one of them were actually discussed with me by my MDS. One when I was diagnosed, which is the first one, which is the most important, which is exercise. So when I was diagnosed, my movement disorder specialist told me that it was really important that I exercise. Now, I wasn't really given any specific instructions. I believe his words were something to the effect that you can box, you can bike, you can tango, just find something and do it. And I was like, okay. I was not an exercise person at all, but I did quickly become one, and now I know it's the most important thing that I can do. It helps my medication last longer, it improves my mood, it helps with constipation, it's just everything is better, and I do that religiously. Although I'm very salty about it, that I got a disease that requires exercise because I'm not a natural athlete or anything, but yeah, finding, exercise, that was probably the main resource that my MDS gave me. But unfortunately, that was pretty much it. All of the rest, I either found out from other people with Parkinson's, through the online community, with social media and things like that, or through patient organizations, or my local in-person support group, which I now facilitate my own in-person support group in my town. And so that would be probably the number one recommendation that I would make to doctors, is that every doctor that treats Parkinson's patients should know about the local support group in their area. It's not that hard. They can just ask their patients. For patients specifically, I always recommend that they call the Parkinson's Foundation's helpline. It's 1-800-4PD-INFO. That's how I found my in-person support group. You just give them your zip code and they tell you which one is in your area. But for me, it was the online community became my support group, and that's probably the biggest resource. The second one was I wish that this kind of was something that came up later, but emphasizing the importance of social connections, of maintaining social connections. There's really good research that shows now, especially post-pandemic, that loneliness, it really impacts our progression with this disease. And so for a lot of different reasons, when you get diagnosed with Parkinson's, part of it is the disease, part of it is medication side effects, different things, it's coping mechanisms too. Like, there's just a lot of times this urge to isolate. And that was not me before Parkinson's. I was a very, outgoing social person. Again, I'm a little bit interesting because I was diagnosed during the pandemic. So at the same time that I was kind of going through that, I couldn't connect socially like I was used to, And so the isolation was coming kind of from both sides, and it took me longer to come out of it, I think, than a lot of people did. But I do think a lot of people still post-pandemic struggle to go back, out. And as my 13-year-old says, people, the peopling is still a challenge, But with Parkinson's, that's probably one of the biggest questions I get from care partners is how do we get our person with Parkinson's out of the house to do things? And I'm like, it's a challenge. It just is. I don't know why. I just don't have that same desire, to do that anymore. So I wish that they had connected me with a therapist, not just for me, but for my family, for my husband, for my marriage. I asked for a psychiatrist referral based on just some recommendations that I read, and I was glad that I did that. But getting a therapist for me post-diagnosis was an absolute lifesaver. And I just think it should be something that's very, very routine, because it's trauma, it's a traumatic experience, and it's a family disease. It didn't just impact me, it impacted my children, my husband, everybody that loves me and that I love them. And so I think giving just, I don't know why they don't routinely do it. And again, not just neuropsych, they love to send us to neuropsych. Like, like therapy, cognitive behavioral therapy, it's a no-brainer to me.